that you can reference it and see it. So welcome, welcome. I am Angela, and we are going to be talking about the Young Living and Clearwater program tonight. So I learned about this program in July of last year. I had heard of it in earlier last year, so a year ago when my company Young Living and Clearwater created this partnership, but I didn't learn about it until July, and I kind of kicked myself. You guys will hear why, because it was almost unbelievable. And I yeah, I'm saving tons of money for my family. So I'll be sharing about that. But let's jump right in. First, let's talk about who is Clearwater. So Clearwater is a healthcare vendor, and specifically we're talking about the health share, which is an alternative to traditional health insurance tonight. So they are a company that's been around for 7 years. They started in 2018, but health shares in general have been around for decades, many, many years, long time. And it is an option for people to get health care and get coverage for medical or holistic needs or wants, I guess, that they have. And it allows people to take control of their health care. So with Clearwater, what's different than some other health shares is that it's actually a nonprofit. So if you're familiar with nonprofits, that means that they can't actually make tons of money. So a health insurance company, the goal is to make money, right? You're probably aware of that. With a health share, the goal is to keep their status. So their goal is to put money back into paying for members' healthcare bills to keep premiums low so we stay. And so it's a little bit of a difference. And the reason that Young Living partnered with this company, Clearwater, is to really disrupt the healthcare industry, to start making a change and a shift so that we can move away from traditional health insurance, because health insurance essentially is supporting sick care and supporting more Western medicine practices, where Young Living supports Eastern medicine practices, being proactive about our health, doing what we can to stay healthy versus, um, you know, waiting until you're sick to do something. A health share, what is it? It is a group of people that pool our money together to cover costs for medical expenses. We pay in a monthly premium that they do all of these, studies and things to figure out what they should be, to help cover costs and, major situations that come up for a certain percentage of people on average. And we pool that together. Bills are paid each month, and we have an annual max. So this is something that's a bit different than traditional insurance. With insurance, you first have a deductible that you meet, and then you also have an annual max out of pocket. With the health share, you only have one number. So you choose, do you want that to be $1,000? Do you want that to be 2,500? Or do you want that to be 5,000? And with health insurance, there are people who have it that's 8,000, 15,000, 20,000, like really, really high amounts that can be their out-of-pocket costs. This isn't as high as that, and people get really good coverage. After you've met that annual max, then pretty much 100% of your costs are going to be covered for any medical situation that comes up, depending on which plan you have, that you've set up for. Health share versus traditional insurance. So I have a little bit of a comparison. Some of it I've already kind of covered, but I do like to cover some of these things in a little more detail. So again, a health share, or our health share, is a nonprofit. Not all health shares are nonprofits. Health insurance is a for-profit business. So with the health share, we have an open network of providers. Again, this is something that's different than health insurance, but it's also different than a lot of health shares. So you can go to any provider. If you want to go to a naturopath, as long as they are a legit naturopath, that's licensed, and they're an actual doctor of naturopathic medicine, you can go to them and they get the same coverage. There's not a list of people that you choose from, so you don't have to worry about living in a specific city or area that you're close to the types of doctors that are on the list. There isn't a list. If they are a doctor, you can go to them. Any chiropractor gets the same coverage. as any other chiropractor. There's no specific list, and that's different than health insurance because you have in-network providers, you have out-of-network providers, and your costs are different with those. So it's allowing you to put costs or put decisions back into your own hands and go to your doctors that you want to go to. With the health share, claims are rarely denied because remember, as I mentioned, like they want us to stay happy. They depend on us to be there to pay our premiums to help cover the costs, keep the costs low, and be able to pay down people's bills and invoices that they have. So those are kind of the differences. Does anybody have any questions? I like to pause at this point to allow you to ask any questions that you might have. No, you guys are easy. Okay. This is my family's comparison. So it's the pricing I'll pull up on a future slide. There's different categories, but my family falls into the age range of being in our 40s. So it's like a 10-year range. So in your 20s, 30s, 40s, 50s type of thing. And so for us in our 40s, we're a family of four. We chose to get medical and holistic coverage. With health insurance, we pretty much had medical coverage plus 12 chiropractic visits. But you can see a comparison here. So with health insurance, we paid $1,560. And with the health share, we're just below $1,000 a month. $45 below. So $955. We doubled our number of chiropractic visits. It now also includes acupuncture. So we went from 12 to 24. Acupuncture was never included before. When I was pregnant with my son, he was overdue, and I went to the acupuncturist 3 times. I think it was $155, and it was 100% out of pocket. I paid for each visit. Insurance doesn't even like recognize it. They couldn't even bill them or attempt to get anything, even though it was recommended by my doctor. So I share the difference in our deductible and our out-of-pocket costs. So our max out-of-pocket before as a family was $16,300, and now it's 7,500. So cut in half, or a little more than half. So big thing for us. And you can see some of the others. I mean, telemedicine, that's something that's pretty common. So that's comparable, apples to apples. It didn't really change much. But the mental health coverage, this is something that is different than a lot of insurance companies. So, traditional insurance companies don't typically have psychologists, psychiatrists available. And with this, it's free, included in obviously our monthly fee. And I love the supplement coverage. So for us, since we're a family, we get $75 a month for supplement coverage of Young Living supplements. So it can be any essential oils and any supplements. Again, this is why Young Living chose to partner with them. And the goal is to really help people to be proactive about their health. And obviously, health insurance, there's nothing like that for any of health insurance that I've ever heard of, I'll say. um, so here next, that there's 3 different categories. So the first box, clear share, that's medical coverage. So that's for major medical situations. You are in an accident, need to go to the emergency room for something, you need to have a surgery, so something major. And then the holistic is more of your proactive. So that's your chiropractic, your acupuncture, doctor's visits are covered under that, whether it's a naturopathic doctor or a primary care physician. So any kind of physician is covered under that. And one of the things that's really also different about Health Share is, again, it's a nonprofit. And so they don't have to follow government requirements or regulations. And so they can deny people if they have pre-existing conditions. So if somebody has had cancer treatment in the last 60 months, that's considered a pre-existing condition. They could be denied, or they could be denied for things related to that. So I always ask questions beforehand. If I haven't done a comparison for you, I'm happy to. And then I bring in my benefits expert from Clearwater if there is anything, and she shares with us what the specifics are. For example, if somebody's a smoker, then their risk for health issues is significantly higher. They can still join the Clear Share, but they don't get coverage, or they get a max. They max out at $50,000 worth of coverage for a smoking related disease, COPD, lung cancer, or something of that sort if it develops. So there's future-based possible issues only with smoking that I know of, or previous things. Like if you know you have a hip problem and you need a hip replacement surgery, and that's been diagnosed, a doctor's told you that, then they aren't going to give you coverage on that type of thing. It's how they keep costs down. It's one of the ways. So there's those two things again, medical, holistic, or you can do a combination. Like I mentioned, my family did a combination, which is what allows us to have much better care or services that we want and need and still save the $600 a month. This right here shows what's covered. So almost everything that anybody has ever asked me is covered. Again, reminder, there's no network of doctors. If you have an accident, an emergency room visit, hospital services, there's the telemedicine, the mental health. Care coordination is a department that's specifically designed and there to help people that need something. So let's say you do need a hip surgery. There is a gentleman that I have an example of. He needed a hip surgery, needed hip replacement, and he had went to his normal doctor. It was going to be $80,000 to have the procedure done at the hospital. And he involved the care coordination team to help him to see if there was a way to get it for a better cost. They did some research and they found out that his same doctor also does the hip replacement surgeries at a local surgery center, and the cost is $40,000. Because he used care coordination, number one, saved $40,000 for the organization. But number two, it waived his $5,000 out of pocket for that procedure because he used that department. So they reward us by using that department and helping everybody save money. And he didn't have to pay anything. He got his surgery and there was no cost to him for that. So it also covers pregnancy, birth, so hospital birth, birth center, home birth. One thing I will share is that you can't be pregnant at the time that you sign up. So I have a friend who his wife was pregnant and he wanted to join in November, but she just had her baby last week. And so they were waiting until after the birth using their traditional insurance, and then they're going to switch. Probably not until March 1st. They had a couple of challenges, so they want to make sure the baby's totally healthy and everything is good since they've already met their deductibles and that. So again, pretty much everything: pain management injections, hormone therapy, medical supplies, nutrition, internal medicine, occupational therapy, physical therapy, speech, massage, all kinds of things are pretty much covered. Hospice, weight reduction, skilled nursing facilities. Some of those are things that are very different than traditional insurance. Depending on the insurance, those may or may not be covered. One thing that isn't covered that I've had a couple people ask me about is if somebody has difficulties getting pregnant, if they can get, is it called IV therapy, I think, from a place to help them get pregnant, that isn't covered. So when I say hormone therapy is if somebody has low testosterone, then that type of hormone replacement injection is what's covered, but not help with getting pregnant, that kind of thing. So birthing related stuff. So first, let's look at the holistic coverages. Within the holistic segment, there is a full holistic program or a holistic savings program. So there's a couple of options within that. And so again, like we talked, it covers supplements, it covers doctor's visits, it covers breast imaging, chiropractic care, acupuncture, IV drips. Generic medications are covered at 100%, so no cost to the individual. If there is a name brand prescription, it depends. So they look at it. Again, that's pretty typical with insurance. It depends on the cost of it to determine what your cost is. Now, again, another thing that's a bit different than health insurance, or maybe very different, is that we as the member are taking on paperwork that a doctor's office might do for us with traditional insurance, especially when they're in network. So when you go to the chiropractor, let's use that as an example. You go to the chiropractor, you pay the chiropractor, you get a receipt, and you get that, you upload that receipt to our website and get reimbursed. So it covers up to 200, well, a total of $210. So reimbursed 175 plus your out-of-pocket cost here of $35. So most chiropractors don't cost that much money, obviously. Maybe a first time visit if you need x-rays and that kind of thing, but it also includes add-on services. So when I go to the chiropractor, my chiropractor offers red light therapy. If they offer massage, you can get massage on the same appointment and have it be covered. And if you buy any supplements from your chiropractor, again, also covered. So I buy it's called LMNT. It's run blank on the word, like a mineral supplement that you add to water, electrolytes. It has electrolytes in it. And so I buy that and it gets reimbursed. So when I go to the chiropractor, my chiropractic visit for my adjustment is $60. The box of the supplement that I buy is either 40 or 50, depending on which one I'm getting. And then red light therapy is like $40. I pay for all of it. I have a specific account that I use for that I make those payments out of. And then when I submit my invoice, I get reimbursed right back into that account. You can get a reimbursed physical check or electronic. Obviously, electronic is faster, so it's what I recommend. It makes it super simple. Now, if it's something on the medical side, again, you're going to use that care coordination department. They're going to help you. And if you go to the emergency room or you're in an accident or whatever, break a bone, and say it's $40,000, you're not paying the $40,000 and getting reimbursed. That's obviously crazy. So when it comes to the medical side, you would get an invoice and you would contact the care coordination team to open a file and you'd submit it. So, and sometimes hospitals or doctors' offices will do that for you on those more major medical things, but it just kind of depends if it's something that's more basic. Most of the time, we need to do that as a member. So I like to make sure that that is explained because it's different if you're used to having traditional health insurance. Then the holistic savings, which is a bit more cost effective and a little more basic. You still get the supplement reimbursement, you get the doctor's visits, and for the chiropractic and acupuncture, it's 12 visits a year instead of the 24. So, but all the like amounts per visit, that type of thing, are the same. And on the supplement coverage, if it's for an individual, it's $50 a month. So individuals are 50. If it's a couple or a family, it's the $75. And then this shows the plan pricing. So this is the part, I know it's kind of small depending on what device you're on and how big your screen is. So what you're looking at here, this one is for the medical coverage only, and it's by age. So you'll see 18 to 29 obviously is much more cost effective than a 15 to 64-year-old person. And then as you're moving across the columns, it's dependent on what is the annual max that you're comfortable with, 5,000, 2,500, or 1,000. My family did 2,500, and we were able to, that's why we were able to save money, but still have our max out of pocket be reduced. And so we did the other one. So this isn't our price that we paid for. But then when you look in each category, it's are you singled? Are you single? Are you married? Single with kids or a family with kids, based off of which box specifically you should be looking at. Another thing that's really nice is, let's say a spouse has a traditional W-2 job, they have health insurance that covers, but it doesn't cover somebody else in the family. You can get insurance for just yourself. I have a few people who have done that they are a family unit, but they don't need health insurance for everybody. They can do that. So this is specifically who are you looking for coverage on? And if you don't need coverage for your kids or your spouse for any reason, then you don't have to get it, type of thing. There we go. And then this here is on the holistic only pricing. So again, if you're single, if you're married, family with kids, this is good for somebody, again, that has pre-existing conditions because it's preset coverages. It's not an unlimited amount of money that's going to have costs. So pre-existing conditions can still get this. There isn't any health questionnaire for this part of it. The medical side is where you can't have a pre-existing condition. This is also really good for somebody who's over the age of 65. Now, that's a person that's most likely going to have Medicare, and this can act as a supplemental for them, especially if they want to be able to focus on holistic types of options where it might make sense for them. And I have a couple of people that do that, but not a lot. But I still like to make sure that I share it. And they're older people. They're not anybody that's had a pre-existing condition that's done just the holistic plan. Cool. So this is a combination. So when you do the holistic savings plus the medical coverage. Again, this is by age, and then whichever deductible you or whichever max out of pocket you're comfortable with. Then I'll just give you a second, and anybody can tell me pause if need be. But again, this one on the holistic savings is the 12 acupuncture and chiropractic visits per year, and it doesn't cover the breast imaging, and it does not cover the IV drip, I believe was the big differences there. And I do want to cover or share something on the holistic part of it, that there are again an unopen or unlimited whatever list of doctors. You can go to anybody. There's not a list, I guess is what I'm trying to say. And so that is something that again is really important to a lot of people in that realm, because you might have insurance that has limitations right now. This is the full holistic plan and its pricing, along with the medical combination. So I mostly kind of, since I already explained the chart, not really re-explaining it, but I pause so you can take a screenshot or zoom in if you need to, and then let me know if you have questions. And then here explains when you have a family unit, the annual max. So I say we signed up for 2,500, but when there's multiples of us, it's not 2,500 per each individual. It's dependent on this. So again, I'm a family unit. I did the 2,500 category, but it's a max of 7,500 total. So if something happened to all four of us at once, Garrett is my husband, myself, and Grace. Each of us would have a max of $2,500 as individuals. But then if we all reached that, my son Keegan, if he had some medical situation, his would be covered at 100%, because collectively as a family, we reached that 7,500, if that makes sense. So it's a maximum of 7,500 per individual, up to 3, for a total family cost of 7,500. And again, what I did is I just have a separate account where I have all of this like building up that amount that I'm keeping in there in case there ever is something major medical. And this is a little behind time on the far side over here, the $10,000 max for the year out of pocket amount. It's supposed to be ready this month, and I just checked with my benefits specialist a couple days ago, and she's like, it's not quite there. So we need to update the slide, but I was hoping that it would be ready before this class. So I like to share that it's coming, and that's really the goal of that, is for people, again, you're healthy, you're comfortable with a larger amount if something were to happen, and you're saving money, or you have a credit card or whatever it might be. There's vision and dental coverage options. Again, these can be individual, as you can see in the top 2 categories, or the bottom, you can do combined. For my family, we did vision, but we kept our old dental policy. They were pretty close in price, but if my kids need braces, the coverage on braces was better. Since the monthly premium was pretty close, then I kept that in, only did the vision for my family. So how does it work? Clearwater is the company that provides the coverage. It's a partnership with Young Living. And so what would happen is you would pay your monthly premiums to Clearwater, then they reimburse for whatever services. If there's something major medical, they make those payments. You work directly with Clearwater for that. It's a super simple online system where you upload any claims or anything that you have. And the partnership between Young Living and Clearwater is what the pricing was that I was sharing with you. Um, when you want coverage to start, it would always start on the first of a month, and you would enroll, do the paperwork all online the month before. So if you did it today, your coverage could start February 1st. You can also choose March 1st or a later date doing your paperwork in advance. Then your first invoice isn't due for your monthly premium until about the 9th or 10th of the month. So February 1st could be your date that your or your premiums and your coverage is activated, and then you pay 9 to 10 days later for that. But you can go to a chiropractor on February 1st or 2nd, or the 3rd, since that's a weekend, February 3rd, and have that be covered. As soon as your account is activated, you could upload the receipt for that. So I'd like to mention and share that. You'd want to make sure that you have an account active with Young Living first. If you don't, you'd set up an account. You can buy something to get an account, or you can set up a free account to get that set up. And then when you go to the Clearwater website to activate it, then you make sure you have your Young Living customer or member number ready. So this is kind of explaining that with the screens. You get your health plan, you pay for it on coverage begins on the 1st, you pay for it around the 9th to the 10th, and then you start submitting your receipts. Normally, reimbursement is about 3 to 4 weeks. Right now, they're a little bit behind, and it's taking 7 because the end of the year got really busy and they got behind. There's also a lot of growth with their partnership with Young Living that I don't think was really properly planned for, if I'm being honest, or prepared. They didn't know that there would be so much success with a partnership with us. So they have gotten behind. But I keep a list and I stay up on mine, and all of them come. So I just last week, I got 5 reimbursements that were chiropractic visits, doctor's visits, and supplement reimbursements that were from November. So I think it's right. Yeah. And maybe even the beginning of December. I placed my Young Living order on the 1st of the month. So those are how it works. So that's me. It's my contact information. If you have any questions, I'm 2 minutes ahead of schedule. I will stay on and let you guys unmute or ask questions that you might have.
I'll go. All right. So you said that I believe you said you can't just go straight to to get a massage, but if it's an add-on from a chiropractor, then you can.
Yes, great question. So actually, there are 2 ways. I'm glad you asked that question. There are 2 ways that massage can be covered: as a add-on at your chiropractor, or if you have a medical need and a doctor writes a prescription for it, then you can have coverage up to $3,000 on the medical plan within a year. So there's 2 ways that massage can be covered. If your chiropractor doesn't offer massage and you don't have a doctor to write a note for a medical need for massage, then it is challenging to get it covered.
Okay, well, that's a good segue into my other question,
Okay.
which is like I noticed hyperbaric was listed.
Yes.
Can you go straight to a hyperbaric facility, or do you need a doctor's referral to go?
You know what? Cami asked me that same question, and I need to call customer service and ask because that one I don't actually know. And my benefits expert, Zaina, also doesn't know the answer to that. So let me write myself a note. So it's funny because obviously I need the answer, but I would like to go myself. So there'll be lots of us that could benefit from that. So hyperbaric, I will get that answer and I'll let you know.
Okay.
Good question. Other questions? Anything from you, Karen?
Yes.
Okay.
What it says hormone replacement. Would that be BioT included?
I'm not familiar with BioT. Um, can you tell me more about it? Is it for females first of all, and is it an estrogen based?
It is for females and males. It can
Oh,
be estrogen based. It is, you have to have your blood work done to find out what your levels are, and then it's specifically made for your what you need. Like my testosterone was low. I
right.
mean, like almost zero, and
Oh, wow.
it's supposed to be like 5, and my husband's, his was really low too. So, but it's for both
Okay,
male and
cool.
female.
Um, I will double check on that. I'm pretty sure the answer is yes. But it was a long time ago that Zaina and I were talking about it, so I probably couldn't like quickly scroll back to the explanation that she gave me. So I'll double check on that one as well and make sure that I let you know.
Okay, because that I don't know if that would cover labs and the BioT both. Because the labs are separate. That you only do once a year.
Right. And then how often do you go for the BioT?
Every 11 weeks.
Okay. Cool. Have you ever used Progestins Plus or Idaho Blue Spruce to help balance out your hormones?
I do progesterone plus.
Uh-huh.
I've been doing that ever since, so probably 4 or 5 months. I
Right.
really don't notice a difference from that, but I use it.
Yeah. Cool. Um, Yeah, Idaho Blue Spruce would be really good for your husband because it's a testosterone thing. It would depend
Mhm.
on you. I've never helped guide a female through using it because I actually don't even know what our testosterone levels are supposed to be. I know what a male's is supposed to be, and have helped multiples with the testosterone issue, and my husband included. And his was just like mild, kind of on the border. But I've also known of a couple different ones that were like to the point of needing medical care, and they were able to reverse it with Idaho Blue Spruce. So I'm happy to share that with
Oh,
you and that
cool.
protocol. So
Thanks. Well,
yeah.
I guess my testosterone was 0 and it's supposed to be 5.
Oh,
And
okay.
so, yeah, I've
And
had breast cancer, and they want, the medical society wanted me to take this other pill for 5 years, and then I come across this BioT, and it's supposed to be even better because it doesn't affect the liver.
right. Interesting. Yeah. That's good to know that it doesn't affect the
Hmm.
liver because that's pretty common with a lot of them. So it sounds
Mhm.
like it's a healthier option
Yep.
that would maybe be related to fewer side effects. So good to
Yep.
know.
Sweet. Thanks.
Awesome. You're welcome. Any other questions before we go?
I think that's it.
Awesome. Thank you guys for being here. I will be around if you have any questions. I'll get answers to these questions and definitely keep you guys in the loop as I get those answers. And hopefully they're good answers that work in our favor on both.
Thank you for
All
doing
right.
this.
Yeah, you're
Thank
welcome.
you.
Thanks for being here, guys. I'll talk to you soon.
All right. Thank you.
Okay.
Bye bye.
Bye.